So that endothelial insult, tear, got torn, something went through there, cut it, infection got in it and hurt it. The interleukins are what coordinates the immune system response to injury. And out of control, it doesn't work. Anybody have allergies? That's a not properly regulated interleukin-mediated problem. So if you have allergies, you already know what it means to have your immune system function properly. It's arguably that is proper in a way. But if your immune system isn't working properly, it can't heal properly. It can't heal the injuries. That's its job. Now, eicosanoids. Eicosanoids, for all practical purposes, are prostaglandins. Now, the reason why I said, well, why do I have to know about eicosanoids? Because the fat you eat makes the prostaglandins either inflammatory or anti-inflammatory. What you put in your face makes the eicosanoids good or the eicosanoids bad. You got to get that, because inflammation and anti-inflammation is extremely important. So again, what am I doing? Where I'm going with this is to empower you, bad word, to care about and implement proper nutrition and proper diet, proper nutrition and proper exercise, so that you can understand the modulatory process to make these things work better. So this is another complex structure, not as big as the cytokines. It's just a molecule. We'll leave it at that. But they dampen down inflammation or upregulate inflammation. Inflammation, in the case of the eicosanoids, wholly derived from fat. If you don't get the right amount, and it's more than you think, of the right fats, you're just kind of like a hot flame. Things don't heal. When they're inflamed, they don't heal. Ever had a tendonitis that hurt forever? That's an inflamed tendon. It's inflamed because your immune system, your eicosanoid regulating system isn't anti-inflammatory enough. That's dependent on eating fat. Fat-phobic people always are in a pro-inflammatory state. So don't be fat-phobic. All right. You don't consider yourself that, but I'll bet you most of you have been programmed to think that. He recognizes that one. I know you do. Okay. Now, mechanical and shear forces. So notice I talked about infection, but again, mechanical forces are important. And the reason why mechanical forces are important is, how in the heck do you get inside and hurt your arteries? If you have high blood pressure, it stretches and tears them. If you do some dynamic movement, matter of fact, there are cases of people who turn their neck who have weak arteries who have a big stroke because they tear their artery. So there are lots of mechanical forces acting on your arteries all the time. The coronary arteries are under a higher pressure than most, so they're going boom, boom, boom. Every time your heart beats, they're under mechanical stress, and with mechanical stress, you get tears, you get mechanical injuries. So we've got infectious, toxic, and mechanical tears that are improved, modulated, or healed through immune factors and inflammatory factors. These are both, well, this is exercise mediated more than this. This is almost completely diet mediated. End products of glycation. Now, you notice I said earlier on that the lipid hypothesis was based on the fact that the damage to the arteries was apparently fat or apparently cholesterol. You got to understand, it turns out that's not what's in there. Well, gee, Doc, I thought atherosclerosis was a big chunk of fat and cholesterol. Surely some of you believe that. Well, it turns out once you just really look in there with a microscope and do a little work, there's all kinds of things in there. Mostly there are immune cells in there. Macrophages, which are the kind that go in there and eat up the damage and suck it inside, and then they go home and die. In other words, they've done you a favor by an auto-da-fé. So the point of that is there's lots of things inside the damage in the arteries besides cholesterol. And it turns out the primary reason that cholesterol ever got there in the first place is because many of those cells were intended to bring the cholesterol there to help in the reparative process. Your cells are made out of cholesterol, largely made out of cholesterol. So we've got to stimulate this reparative process. And to get to this, one of the things that's inside there is glycated proteins or glycated other products. glycation. Remember, that just means it's got a sugar molecule hooked onto it. If you eat, and we're talking about diet again, if you eat in a way that you've got more sugar in your blood than you need, you're going to stick a whole bunch of sugar on proteins. It's just a natural chemical reaction, and those glycated products are what damages the repair process or inhibits the repair process. So that's very important. Now, again, we're talking about now we're going to talk about inhibition of the endothelia themselves. So we've got the whole immune system doing its best to manage repair. We've got an inflammatory process which is locally responding to damage, and we have lots of reasons that cause damage. We've got some bad stuff stuck in the repair process, but here we actually make the cells themselves unable to respond to any healing stimuli. What makes those cells less able to heal? Simple things. Insulin. Well, doc, I thought we had to have insulin to be healthy. Yes, it's true. You have to have insulin to regulate your blood sugar. But on the other hand, it is a very common thing in overfed people. I didn't say skinny people. I said overfed people, or inappropriately overfed people. We'll get to what I mean by that. That their insulin, let me illustrate. I've got patients who have a fasting glucose of 80, average blood sugar of 80 for 90 days. They've got an insulin level of as high as 50 microunits. Well, that doesn't mean much to you, except normal's 5 or 6 or 7. In other words, it takes 10 times as much insulin to regulate their glucose at a normal level. Well, if that happens, they suffer the insult of the insulin instead of the benefit of the insulin, okay? At high doses, this is one of the most toxic substances that naturally occurs to your endothelia. It's very toxic. Lots of evidence of that. Histamine. We were talking about allergies. When your allergies are flaring, anybody ever get hives when their allergies are bad? Your blood histamine levels are quite high. Turns out that interferes with the endothelial function. We say, what the heck are these guys doing? I mean, what do they have to do? They're just tiles. This is very toxic to the endothelia. Alcohol. Period. It's poison. You can take an endothelial cell, put it on a culture plate, pour alcohol on it, they all die. So don't ever get confused about that. Alcohol is toxic to the endothelia. Insulin doesn't kill it that way. It just kills it more surely over time and causes other damage. Now, many of these endothelial insults, not insults, that affect the cell itself, are nitric oxide mediated. The reason why you want to know that is nitric oxide is one of the most potent oxidative chemicals floating around in your body. Oxidation. Everybody's worried about antioxidation. Let me tell you, the byproducts of nitric oxide are some of the most destructive oxidative forces in the human body. You would die without it. So don't think you don't need it. And we're going to get to that later. We're going to talk about balance between oxidants and antioxidants. And why am I painting this complex picture? Because I hope you'll begin to see if any of this is making sense, and I'm not sure I'm doing a good job of that. If you begin to see it, there is nothing subtle enough to respond to this complex demand other than what you put in your mouth and what you do with your body. And what you put in your mouth, I mean food, and we'll talk about that too.